Okay, good evening, everyone, and welcome to the session on parenting in the digital age. We are privileged to have Dr. Vivek here with us today. Dr. Vivek is currently a consultant psychiatrist at Renai Medicity Hospital. He has an MBBS, DPM, and MD in psychiatry from Trivandrum Medical College. We had an enlightening session with Dr. Vivek for our grade 9 through 12 students, so we're fortunate to have him back again for a session exclusively for parents. So today is our session for parents of students grades 6 through 8. So welcome to all parents. And I kindly request everyone in the meeting to please mute your mic throughout the entire meeting. We will have a question and answer session at the end of Dr. Vivek's presentation. So please use the chat box to ask any questions you have for him. And if you are joining us via YouTube, you can use the comment section to ask your questions. Okay, so Dr. Vivek, again, thank you so much. Always welcome and a warm welcome to you. And I'm going to turn the time over to you now. Okay, thank you.
So, is it visible?
Yes.
Okay, and it's moving too, right?
Yes.
Yeah, and I'm audible, right?
Yeah. You are. Good to go.
Yeah, so we'll start. So thank you, GPS Global Public School, for calling me over. Good evening, everybody. Good evening, parents. Good evening, teachers. Thanks for joining in. So I'll be talking today about parenting. It's been a difficult period for everybody. Parenting has always been tough, but in this digital age, it is getting a little tougher. So I'll be talking to you about the problems you face in parenting, how you can identify the lacunae and tackle it, and common learning and behavioral problem in children which could interfere with parenting. Okay, so we move on to the topic proper. So parenting the dream. So every parent has a dream to be a proud parent, to raise well-behaved children, to teach a child to be in control and stable, to be self-reliant, responsible human beings, and to have a successful role in society. So this is the dream. Unfortunately, many a times this dream goes a little sour, and this is a scene which we see many a times. Actually, not all parents, but some of the parents who come to meet me at my hospital at Renai Medicity OPD, what we find is parents are totally clueless, helpless, hopeless, worthless. They have absolutely no idea what to do. They are in a crisis when they come over. Either it's a problem at school, or it's some other legal issue, or it's an academic problem. That's when they come over. So the whole point of this talk is to avoid such situations, to preempt such situations. So there are multiple styles of parenting. One is called the authoritarian style, where it's more of punishment, autocratic rules and regulations, where obedience is demanded. It's very rigid, and it's more like I'm the boss kind of thing. So in this style, a lot of issues could happen. Then there's the authoritative type, where it's a little more flexible, where it's more of enabling, being more assertive, more of self-regulation, and being democratic and taking the child along. Then there is the uninvolved one, where there's a lot of distance, there's a lot of disinterest, a lot of neglectfulness, being passive, being absent, etc. This could also lead to problems. The most problematic is the permissive one, where instead of the parents being the boss, it's a child who's the boss. There's a lot of appeasement, there's a lot of blackmailing happening. There's no guidelines. It is being over-involved. The roles are blurred. You're being totally indulgent, lenient, etc. So some of these styles have serious issues and could lead to serious issues at home. So this is another style which the picture itself shows. It's a mother coming in a helicopter. So this is called as helicopter parenting. So just like a helicopter hovers around the child, you see in such parents, they just hover around the child. They do not allow the child to do anything on their own, but keep on hovering around the child, helping in everything, getting involved in things where the child should do on his own or her own. But such a parenting style actually makes the child develop a lot of issues, becomes totally dependent on the mother, etc. So this is also not the kind of style we would ideally like to have. So what is the outcome of an authoritarian style, which I described earlier, where you're very strict, etc. There is punishments, etc. The child may become obedient, but unfortunately becomes distrustful, discontent, withdrawn, unhappy, hostile, and once they reach adolescence, they could rebel, and they unfortunately do not become high achievers. So the authoritarian style, which was there long back and is still being continued by many, is not the right way forward, at least in this new age, the new digital age. So what is the outcome of a permissive parenting, where everything is allowed? The child becomes a little more aggressive, less self-reliant, less self-controlled, least exploratory, and mostly unhappy. So even the permissive parenting is a cause of concern and could lead to issues. What are the outcomes of the democratic style? In this, you find that the children are more happy, they're more self-reliant, they're less self-controlled, they're content, they're friendly, they're generous, they're cooperative, they're high achievers, and less likely to be delinquent or disruptive. So this is the style we want, where we're not too free or not too strict, something called being firm. And you take the child along and you discuss with the child and move along. So what can parents do? So parents need to educate the children, supervise the children, and of course, protect the children. This is the hallmark of parenting. So every time I present such things, teachers and parents tell me, we know all these styles, we've gone through all this, etc. So when a problem behavior comes, how do we manage it? That's what is more important. So I'll be dealing with that now. So when a problem behavior, child gets irritated, child gets angry, child starts demanding, what do you do? In some families, you find that children are hit, or sometimes they are scolded. There's a lot of nagging. When you fight or scold or abuse a child, what you find is your anger just gets reflected on the child, and your anger just comes down. But unfortunately, that behavior continues. What do you have? What happens if you ignore the child? A little bit of the problem behavior comes down, but it again comes back because the core problem still remains. The worst thing you can do is to bribe the child by telling that if you do so, I'll get you that, etc. So there have been many cases where, to get good behaviors, parents have promised things to children. It increases to a point where the parent cannot give anything to the child, or cannot give the thing demanded to the child, and finally it becomes a huge issue. Like there was a child from a prominent school, who got pretty good marks, was given a branded shoe. Next time he asked for a branded phone, that was also given. The next year he asked for a branded laptop, that was pretty expensive. But then the parents realized that this was getting out of hand and did not give it to him. But it caused such a ruckus at home that he destroyed everything at home, and it was a huge scene when they presented over. So it is just not the child to be blamed. Unfortunately, parents were giving everything and anything to the child even before the child was asking for it, or instantaneously. So giving the child everything and anything immediately when asked could be a cause of concern, and bribing the child is definitely not the way forward. So what can you do? So there's a simple technique called ABC, where B stands for behavior, A stands for antecedent, which is what led to the behavior, and C is the consequences. So any behavior can be modified by changing the antecedent, what led to the behavior, and adjusting the consequence. So this is how it is explained. So any behavior, any problem behavior can be changed by modifying the reasons that led to the behavior and the consequences of the behavior. So there are 5-6 things which I always tell parents who come over. One is to be consistent. That is, if there are if it's just the parents at home, it should be, if it's a yes, it should be yes, and if it should be a no, it should be a no. It should not be yes from the mother, no from the father, yes from the father, or no from the father. Or if there are grandparents, like it can be please just do what the child wants, etc. So everybody has to speak in one voice, and it should be consistent, be it at home or be it in other places. Next thing is, you should not criticize the child. Unfortunately, what happens is, when the child does not behave in a manner we want, we criticize the child, we tell you're good for nothing, etc., which unfortunately does no good other than reducing the confidence of the child. So instead of criticizing the child, it would be better if you labeled it a little different or reworded your words like, okay, your behavior is a cause of concern, but you're good. So it's the same thing, but we're just rewording it. Along with that, you tell the child why this was done so. Don't do it in a nagging manner where you continuously tell it, but you can tell it once or twice so that the child understands why this particular thing was done. Okay. And along with that, instead of fighting, hitting, scolding, etc., what you can do is you can withdraw privileges. Privilege withdrawal is the best thing to reduce any bad behavior. And last but not the least, you should encourage good behavior and definitely not bribe or promise anything. So this sounds great, but it's very difficult to practice. It's all about trial and error. So I repeat it again, you should be consistent, you should speak in one voice, you should not criticize the child, but criticize the behavior. Tell the child why it's being done so. Withdraw privileges, and withdraw privileges is very important because if a child does something wrong, you withdraw privilege maybe 5 days later, it doesn't help. You have to do it that very day, and the child has to be made, has to be informed that this is why this is being done so. And when you continuously do so, good behaviors are encouraged and bad behaviors come down, and there's a huge change in the behavior of the child. So good behavior increases and bad behavior comes down. So it's a continuous process. It's more of trial and error. But if you do so, and if you're consistent and everybody works as a team, it is definitely possible in any household, especially during this COVID times where everybody's at home, work from home, etc., where there's a lot of interaction now, much more than before. So how do you foster a child's self-esteem? You need to give a lot of encouragement. That's very important. You have to encourage the child to do things. He may fail, she may fail, but at least you'll have the satisfaction that they tried. And encourage those successes in the child so that they can get confidence from them. And you have to help them or give them the freedom to fail without acceptance. It doesn't matter whether you fail, but we have to know that you've done your best. Give unconditional love. Allow independence. Of course, you are with them, but give them independence. Do not set standards unreasonably high. What you find is your neighbor's son has great grades, you compare with them, or your family friend is doing so, is playing so, is doing this, that. No, please don't compare. And definitely, if your child is not reaching those levels, lower the standards a little lesser so that your child can achieve them. Avoid ridiculing the child because that could affect the confidence, and eliminate the negatives. Try to focus on the positives. Try to explain why this particular thing could be done in a better way. Be available. That's very important. That's what we tell everybody. It's very difficult. Quality time, at least the time you spend with the child, please try to be available for the child. It could be half an hour, it could be 1 hour a day, but that itself could make a huge difference because there are children who come over and tell us that our parents have no time for us. Be a good role model. You ask your child not to use gadgets, but you are constantly using gadgets. You are fidgeting with your mobile, telling the child, don't use your mobile, don't use your iPhone, or you use your tab, but you're constantly fiddling with it. You're totally on it. You sleep late. So you need to be a good role model for your children. So that's very important. Give your children responsibility. Unfortunately, in this age, we don't give our children responsibility. Small things could make a huge difference. And it's always best to tell your children about their financial responsibilities too, on what is happening at the home, how is the finances at home, so that they don't give unreasonable demands, thinking that everything is going hunky-dory. Okay. Take their ideas, emotions, and feelings seriously. Many times, small changes in their behavior are just brushed away, but it could be leading to a host of other things. Help your child develop talents. Because there are many parents who come over and tell, my child has absolutely no talent. He or she is good for nothing. Yes, every child has talents, but you understand the talents only if you allow your child to explore. He may fail or she may fail maybe 8 times, 9 times, but one time you will find that, okay, there's something in that particular area and you can help the child move into that area. Set limits. That's what I said. It's not being too strict or too free, but to be firm. Allow exploration and encourage questions so that there's a proper communication at home. Unfortunately, many of the cases which we come over, or maybe 50% of the cases could have been solved at home if there was a communication at home. And because it usually starts at adolescence. Adolescence starts at around 10 years. Till then, your child would be very free with you, would discuss everything and anything with you. But by the time the child reaches around 10 years, which I think is the age most of your children are, maybe 6 to 8 grade, what happens is they start discussing more with their friends. They discuss less with you. They are into their private space. They don't want you to intrude into your private space. But see that the communication channels are still open. Tell the child once in a while that if you have anything you can discuss with us, we'll discuss it in a very non-judgmental way, and we are here to help you. We are your best friends, etc. Small things, but it could make a huge difference. So what are the qualities seen in good parents? It's like I said before: nurture, care, love, discipline, not being too strict or too free, but being firm, quality time, communicating, give time and space for the youngster, enhancing the self-esteem and respect of the youngster, and making time and space for themselves. So what are the methods you can do to do all that? One is to listen. Please, like it may sound very funny or very odd, but listen to them. Maybe you'll find something in their talk which could help you connect with them better in a supportive way. Encourage talk, take time to allow your children to verbalize their problems and feelings. Sometimes you realize indirectly that there are problems, but unfortunately you just can't understand where the problem is. So a little bit of talking with your children could allow them to verbalize their problem. Problem solve. Everybody of us has problems to solve. Life is all about solving these problems and moving on. So help your child to solve these problems by giving them solutions to their problems, or allowing them to problem solve and guiding them, and avoid negatives. So we move to the next part. These are the common learning and behavioral problems which could interfere in parenting. And unfortunately, many of these problems come to us only when there is a crisis. So it's all about preempting them, and many of them are seen in children, and it's on the rise. So ADHD. So this is very common, getting very common these days. It's attention deficit hyperactivity disorder. It's pretty common, and some of the symptoms are attention problems. That is, to be precise, the child has problems focusing, loses interest fast, is not able to sit in one place, is fidgety, runs around, when asked to study, wants to go to the washroom, tells about pains, aches, etc. Is a little impulsive, jumping into things, demands, getting irritated on small things. So unfortunately, parents and teachers misdiagnose or think that such children are arrogant, lazy, etc. They don't seem to learn from experience. Unfortunately, this is not a child doing it purposefully, but it is due to certain neurochemical changes in his or her brain which is causing this. And if this is not taken care of properly, that is, if it's a mild case, a little bit of behavior management. If it's a moderate to severe case, we need a little bit of medications to improve the attention, reduce the hyperactivity, and behavior management for the parents. It could lead to a lot of problems in adolescence, even things like addiction, etc., in future life. So, just like I mentioned, you find that there is excessive activity, restlessness, trouble coping with stress. There is difficulty multitasking. There is a low frustration tolerance. There is disorganization, poor planning, poor time management skills, difficulty focusing, mood swings, hot temper, etc. So this is pretty common. And when there is a serious issue at school, they come to us. Usually seen at 6 years. So the important thing is if it's taken care of early, that is at 6 years, the 6 to 10 years decides the foundation for the academics. So what happens is after a particular point, the child finds it difficult to study, focus, etc. So the grades start dipping because there is more to study, more portions, etc. And they're not able to focus, so the grades start dipping. So that is the attention part. Hyperactivity leads to difficulty sitting in one place, focusing, running around, could be problems in school, etc., getting into fights, etc. So if it's treated properly, it is totally manageable, and if it's done early, it could be great for your children. Next is something called conduct disorder. So what happens is if this ADHD, the problem which I told earlier is not treated, once a child moves into adolescence, what we find is such children develop a lot of behavioral issues like lying, stealing, getting into fights, and not respecting the rules of society, getting into gangs, getting into addictive behaviors, etc. And unfortunately, the most important thing is they have absolutely no guilt about their repetitive acts, and they seem to repeat the same thing again and again. So this is a cause of concern. So what happens is this ADHD is a continuum. It could lead to disruptive behaviors like conduct disorder, which is a cause of concern in the future. Next is learning disabilities. This is also on the rise. So it's not exactly learning disabilities. It's rephrased as learning disorders now. So what you find is child is intelligent, etc., but they have a problem in some particular subject. Like it could be math, it could be English, it could be Hindi, it could be Malayalam, but it could be reading, it could be writing, it could be speaking. Maybe in that particular area they have a problem. And what we find is the first sign would be maybe in your lower KG or upper KG, you find that the child mirror writes, like D is written as D, C is written as E, 6 is written as 9. So it's all written ulta pulta. It's like looking into a mirror. So that's called mirror imaging. When you see that the child goes into higher standards, their grades start declining, they have a difficulty completing notes, there are spelling mistakes, etc. So what we find is this is also again totally misdiagnosed, and only when the child has serious issues do they come to us, or in their 8th or 9th grade when it's time for them to skip a subject or they want extra time, they come to us. But unfortunately before then, the time for remedial training where things could be done to improve the learning disorders is lost. So if it's ideally done between say 5 to 10 years, such learning disorders can be taken care of. So this also is something which needs to be taken care of. Childhood depression. Everybody knows about depression in adults and old people, but what about childhood depression? This is also misdiagnosed many a times. When you are depressed, if you are an old person who's depressed, what you find is you're low, you feel happy, you're amotivated, you have helpless, hopeless feelings, etc. But unfortunately, in childhood depression, which is on the rise, actually I get about 5 to 10 cases every week. Children between the age of 5 to say 15, childhood and adults depression. So what we find is instead of that low mood, what we find is a little bit of irritability, anger, etc. Oppositional behavior. So in children, it could be anger, and this could be misdiagnosed or this could be mistaken as the child being arrogant, etc. So this is a cause of concern. Just last week, I had a case from another school in Cochin where the child had depression. He was not talking to his parents. I think he was in 8th grade. So and he took an overdosage. So the whole point of this talk is to preempt such conditions and to see that such things never happen, because suicide is only preventable. You cannot treat it, but you can only prevent it. So the culmination of childhood depression could be things like suicide. So you have to understand if there is a change in your child, definitely try to talk out with your child or seek the help of a qualified mental health professional like a psychiatrist who can help your child, because this childhood depression is again important, because what we find is people who have depression in as an adult, we find that there are a lot of cases where it is undiagnosed childhood depression because it is not treated properly, and that could lead to a host of personal, professional, and academic problems in the future. So this is another thing, autism. This is seen in younger children, but again, sometimes it's misdiagnosed. There are milder forms. The child has problem, connecting with people. There's a communication problem. There's a social interaction problem, and unfortunately, it's again misdiagnosed, or it's taken for treatment very late. The first thing is to not have eye contact, sustained eye contact. That is, you don't look into the eye and speak. And repetitive behavior, attention problems, hyperactivity. You ask a question, the question like if you ask what's your name, instead of telling the name, you start repeating name, etc. And there are milder forms of autism, like things like Asperger's syndrome, where communication is okay, but the social connectedness is not there, and that could lead to a host of problems. So this is also an area. And the good thing about autism is if you give early intervention, the results are great. I've got many kids who come to us at 2.5 years, who have taken intensive speech therapy, occupational therapy, behavior management, etc. They're doing great, maybe one grade lesser than other children of the same age, but they're doing great now. So this also needs to be taken care of. Addictions. I'm telling this because it's getting very common. This may seem funny, young child smoking a cigarette, but it's on the rise. Every week between the age of say maybe 10 to 20, I get multiple kids. Girls are on like before it was more of boys and less of girls, but even girls are getting into addictions. And um, and what we find is it is not smoking, drinking, etc. that children are into, but things like weed, cannabis, which they're getting into. And like there was a kid from a prominent school, and when I asked him, why do you smoke weed? He said, everybody smokes weed. Everybody in my gang smokes. He was just a ninth grader, but he said everybody smokes weed, and it's good for my body. And what's wrong in smoking weed? So these are the questions children ask, and sometimes they get these misguided opinions from their friends, and they could land into trouble. And please, these things are the problems these things cause are huge. It is irreversible, irreparable damage to the brain, and it can lead to depression, anxiety, anger, fearfulness, etc. And the damage is huge. So please be careful. You really need to know who, what your child is interacting with, and we need to preempt it. So moving on to the major issue these days, which is the new age addictions. Things like WhatsApp, Facebook. I've not named it PlayStations and Instagram. So very recently, I had a patient, and not a patient. They had come with serious issues. What I found out was this particular girl was chatting, and unfortunately, the parents didn't know. The children of this age don't use WhatsApp or Facebook chat now. They use things like Instagram chat or something more, Snapchat, etc. So she was using Instagram chat, and she was chatting with an anonymous person, and some photos were exchanged, and that got her into serious trouble. So the parents got to know about it very late. So please, you really have to know who your child is interacting with. Please do not keep laptops, desktops, etc. In secluded rooms, but keep it in a public place. I'm not asking you to constantly check your children's account or constantly monitor them, but you really need to know what is happening in their life, and there could be many issues where they're landing into trouble. So addictions are on the rise. The mobile phone is becoming more like coke and cocaine. And another problem is what we find is, as you see in this picture, you see that everybody is engrossed in their own gadget. So one thing which we ask all parents is at least one meal. Forget about breakfast, forget about lunch. At least have dinner together so that you really know what is happening around. You understand the body language of the other person. So please avoid gadgets then. So for at least 15 minutes to 30 minutes, at least you can talk to each other freely without gadgets. So this is another common problem now. When we ask children to play, go out and play, they tell there's nobody to play. Just like this kid, he's ready to play with his football, but if all his childhood friends are onto playing FIFA or football on their computer or on their laptop or on their iPads or on their mobiles. So you need to give your child time to play, and that is physical activity, not gadgets. So things like internet and gaming addiction are on the rise. There have been multiple cases which have been brought over, and there have been cases where children have been given PlayStations when they have done exceedingly well in their studies. But initially they start with half an hour, they move to 1 hour, 2 hour, 3 hour, 4 hour. It's multiplayer games. They play with people all around the world and their friends. There are games which go up to 2 o'clock, 3 o'clock. There have been children who play 24 hours. When asked to stop, they create a huge ruckus at home. So please, I'm not asking you to stop gaming, but keep a control over them. Ideally, what I tell parents is, at least during weekdays, say between Monday to Friday, keep it to half an hour to 1 hour, and maybe weekend, Saturday, Sunday, keep it to maybe 1 or 2 hours, not more, but with a physical activity component added to it. Plus, no gaming after 10 o'clock because it goes on and on. It's highly addictive. So there are things like this internet gaming addiction, cyber relational addiction, cyber sexual addiction, information overload, OTT app addiction, communication obsession, etc. So just about this cyber relational addiction. So there was another kid who was brought by a parent. She was into something called Korean pop, K-pop. That's what I knew such things were there. And what she said was she came out to her mother that she was bisexual. And when her mother, who was an IT professional, she really didn't know what to do to her. So she was brought over, and when we discussed, we just understood that she was just going through her adolescence, and she was not. There's nothing wrong in her sexuality, but uh, unfortunately, she was getting into talks with people. Actually, she had a friend in South Korea, and she suggested that she could be bisexual. She tried googling it, and as usual, Dr. Google gave her uh, an interpretation which made her feel that she was into such things. Actually, she was just into her adolescence, and she was just confused. And there are many children who exchange pictures, etc., thinking that with anonymous people, with total strangers on the net, and there have been many instances where such images, pictures, etc. Because children think that the net is totally anonymous, nobody can trace them. But please understand that there is a digital trail for everything. Another thing is these apps. It could be the OTT apps like Netflix, etc. There have been children who watch continuously. It's highly addictive. You just can't stop at one episode. You move to the next episode. Food app use is also excessively on the rise. The childhood obesity has increased multifold. There have been huge fights in home where children want to order from Zomato, from Swiggy, etc. And it becomes addictive. They need to order daily. They don't have home food, and if they don't get it, they use the parents' cards, etc. And there have been many instances where it has been misused and it's got them into trouble. So, what are the signs of gaming internet addiction? So, it is sneaking time on the internet, decreased interest in other activities, just can't keep away from the phone, difficulty not playing games, chronic arguments around the game time when asked to stop, academic decline, irritability, and what we find is up to 10% are addicted. But we really don't know which group of children get into it. There's a small percentage who could be more addicted. So, what are the physical problems associated with it? You find that children have sleep disturbances, they've got migraines, headache, backaches. They have things like carpal tunnel syndrome, where they have pain on their hands. They have eye irritation, dry eyes. And there have been many cases documented where children who played for hours and hours have developed even seizures and even death due to excessive gaming. So, what are the psychosocial issues associated with it? There is decreased interpersonality. They're totally engrossed on the game. There is depression, anxiety. They are desensitized. They're over focused on games. There are anger outbursts, fatigue. Their social skills are a problem. They have conflict with parents. They have lower grade. There is impaired attention span. So, unfortunately, what happens is when you play a game or you see a movie, you get instantaneous high. Actually, there's a hormone called dopamine in us. When it increases, you feel high. So what you find in such children is when you play a game, it's a fast thing. But unfortunately, life is slow, and they have difficulty adjusting with the slower life, and so they get into issues in the real life. So one more thing is screen time. Before the pre-COVID era, I would recommend all these things, but it's getting difficult. So now what we tell is, other than school time, how much time should be given? So if the child is 18 months or younger, absolutely no screen time. What we find in many houses is, to feed the child, you give the mobile. If you want the child to be quiet, you give the mobile. No, that's a very wrong way of doing it. 18 months to 2 years, you have to restrict the screen time. 2 to 5 years, maybe 1 hour a day. 6 years or more. So again, all these restrictions are other than the school time. Okay. And it's just not school time now. These children have academic things at school, tuitions. Then they have online other classes, extracurricular activities, etc. So the screen time is increased multifold. So at least the the other time you get, at least ask them to have a little bit of direct interactions, play some board games, some kind of physical activity, etc. So what happens? So what we find is such children who are more into such games, etc. What we find is they have difficulties in the future life, in their personality, in their impulse control, in their reasoning, in their empathy, etc. And it undermines their academic success and their serious relationship issues in the future. Another thing which we find very common and which you're going to see in the coming days is something called exam anxiety. Usually what we find is during that exam time, we get multiple children coming over who present with such problems like tension, anxiety. Once the exam schedule comes out, they have difficulty understanding, studying, they don't get sleep, appetite, they go to the exam, they just forget everything, etc. So for milder cases, a little bit of behavior management alone suffices, but for moderate to severe cases, it would be advisable if a little bit of medication is taken. Because what happens is a little bit of anxiety is always good for us. Like if you understand that you're going to fail if you don't study, you will definitely study. But if you understand that if you have the feeling of excessive anxiety, whatever you study just disappears. So eating disorders. When I was doing my post-graduation long back, maybe 9-10 years back, this was very uncommon in India, but now every week I get at least 1 or 2 cases of eating disorders, especially in female children. What we find is they have body dysmorphobia, that is, they have problems about their appearance, so they start eating very less or they start vomiting, etc. And this leads to a host of problems. And one more thing which I forgot to mention is, along with the eating disorder, there is one important problem which is called borderline personality disorder, which is again found in younger females and adolescent females, in which the child has mood swings, irritability, anger, sensitivity to criticism, low stress tolerance, etc., which could lead to interpersonal issues. So this also is a cause of concern because this is the age where the personality is formed and it could lead to a lot of problems. Last but not least, we're going to talk about abused children. Every one of us thinks that our children are safe, but unfortunately, we have to be careful. Abuse is on the rise. Every 2 to 3 months, I get 1 or 2 cases, and there's a misconception that it is more of girl child which is abused more, but what we find is even male children are abused. So small things like a change in the behavior of your child, pain in the genital area, pain during menstruation, pain during urinating, pain during defecation, stomach pain, a sudden decline in academics, not wanting to go to school, not wanting to interact with other children, other children and other people, etc., could be signs of abuse. And please, if you somehow suspect them, please do not criticize them. Be with them. Tell them there's nothing wrong. They've not done anything wrong, but we will help you get over it, etc. Because what we find is a lot of children have such issues, and they move on to adulthood. They have multiple issues, psychological issues, and we find adults who had psychological problems, they always had some kind of abuse history when they were children. So this is getting common, and there is nobody better than parents to stop such things, to be with your children. And if at all something happens of that sort, please tell your children to be open with you. We're not going to be harsh with you or critical about you. And one more important thing, that good touch, bad touch, these are small things which you can incorporate to the child from a very young age, appropriate to their age. And as they move forward, you need to tell them about sexual education too, appropriate to their age, like a mother to a girl child and a father to a male child. So I think that's the last of my slides. Thank you for a very patient hearing, and I hope I've been able to help you, and I hope you have a great time parenting your children, and so that they have a great future ahead. So I think we'll move on to the question and answer session.
Thank you, Dr. Vivek. That was very informative. So thank you for that. Yes, we'd like to please open it up for questions. Please use the chat box here to ask any questions you have for Dr. Vivek. And also for those of you on YouTube Live, you can use the comment section to ask questions. We also have access to those, so please ask some questions. I have some questions that some parents have sent me directly. I'll start with those.
Yeah.
Yeah? Okay. So we have one says, when I ask my son to stop playing video games, he says 10 more minutes. After 10 minutes, he asks for 5 more minutes. This continues. How do I gain control of this situation?
Okay. First and foremost, see, the most important thing is try to avoid gaming. One. But now it's very difficult because all children have games, and because all their friends are into gaming, and unfortunately, because they are all stuck at home, that's the only time they get to interact with each other. But at least keep time limits. Be very particular that this is the time allotted for you. Like say the thing which I mentioned, half an hour to 1 hour on a particular time at a particular day. Maybe weekends, maybe you can move on to say 1 hour to 2 hours. But after that particular time, it will be taken away. And if you do not follow it, next day we have to cut it. So that behavior management principle, which I had explained before, you don't listen to us, we're going to withdraw the privilege. So to at least get the privilege, they will do so. So keep time limits, set limits, and if they overshoot it, you withdraw the privilege. So at least the next time to at least get those things, the child would fall in line, but it's a trial and error method.
Okay. Well, this is maybe a follow-up question. They feel like their child is already into gaming, a little addicted, and they feel that their child needs help, but refuses to seek help. So how can I convince my child to see a psychologist or a psychiatrist when they have screen addiction?
Okay, the first thing is we have to find whether it's an addiction or not. So it could be simply use, it could be excessive use, it could be addiction. So it is addiction when the child is constantly using it, is using it for hours and hours, it's increasing on a daily basis. The other areas, the interpersonal relationship, the academics is all getting affected. So that's when the addiction comes. Second is when you withdraw it, the child gets all irritated, worked up, gets aggressive, etc. So these are all signs of addiction. So if that is so, that should be make you understand that it's a red flag sign and some intervention has to be done. So what you do initially is from your side try to set limits. If that limit is being breached, then you need to seek the help. Either take the child along, and in this case, if the child is not agreeing, at least you can meet the psychiatrist or psychologist who could advise you on the way forward. Okay, so there are many cases where the child refuses to come, but at least you can meet a person like a psychiatrist, and he or she could guide you on the way forward. So just because a child does not come, that's not the end of the story, because next, when it becomes a serious issue, you may have to definitely go and see. So it's all about preventing such a situation. You can definitely meet a psychiatrist who can help you, guide you on the way forward.
Okay, and do psychiatrists have online consultations? Do you offer online consultations?
Yeah, definitely. Because from June, I've stopped all consults at home, and it's all online. And actually, after this 7 o'clock, I'm just lined it up till 9 o'clock. So usually, this is the time which I consult online, and almost all psychiatrists have online consultations, and you can sit at your home and consult, and it's very much possible. But maybe at least one consult, I would prefer a real-time visit so that we can do assessment, etc. But there are multiple cases where we do even without that in the current state of things.
Okay.
Yeah.
No questions have come in, so I'll keep asking these. At what age should I let my child join social media like Instagram or Snapchat?
That's a very difficult question to answer. But at least till maybe mid-adolescence, maybe 13, 14, 15, at least after 10th grade. Till then, I wouldn't advise. but it's very difficult these days. What we find is even if the parent doesn't allow, they go on such sites, they create sites or use their parents' ID, etc. But even if you allow your child to do it, it should be an account where you know the password, where you have a supervision of your child, and where you know what he or she is doing. Because social media, though is considered by children to be pretty safe, it is not a safe place. You really don't know whom they are interacting with, whether it's a male, female, what is their reasons for the interaction. Like the example that I told you, where a child was misguided about her sexuality by a person whom she had never seen in her life, and she believed that person more than her parents. So there have been multiple instances where children have got into trouble. So you really need to know what your child is into. So try to avoid social media to the maximum. But if it's a big must, you need to have a close supervision. And even when the child uses it, you have to be around, not constantly looking into it, but at least you really need to know who or what is happening around.
Okay. Okay, so another one is, my daughter is 13, but many of the teen shows she watches on Netflix says 16 plus or sometimes 18 plus. She says that there's nothing, quote, bad in these shows, but is it okay that she watches shows like these? As a parent, should I pay more attention to the rating?
Yeah, of course. Because see, what's happening in these what do you call OTT platforms, etc., is there is absolutely no censorship, and a lot of explicit matter is being shown. So, as an adult, you would realize that what is being shown is not what is happening in society or is not the norm. But children could get misguided and could get wrong information and believing that such things are what is actually happening in society, though a little bit of it is actually happening, but they could get wrong views. So that is a big no. It should be age appropriate. And watching shows which are for what do you call older adults is a big no. And they're pretty smart, these children. And I think there should be a little bit of control, and the child should not be allowed to watch such things.
Okay, yeah. My child seems sad, but always says nothing is wrong when I ask.
Okay.
How can I get him to open up?
Yeah. Okay. So the thing that I mentioned before, childhood anxiety, childhood depression, etc., is getting very common these days. The first and foremost thing which we find in them is a little withdrawn. That is, they are always into their room. They close the room. They close the doors. They do not open it. They do not come out. They don't come out for socializing. I mean, many instances such children have come out. So it could be a tip of an iceberg. It could be a start. So that's where you start conversing with a child. You start talking on topics with the child likes, and be very particular that you cannot close the room, or that no private space thing where I'm totally closeted in a room. No, that's not possible. So a little bit of talking from your part, going about things which are of a source of interest for that person could help in opening up. But if it's moving to an anxiety or a moderate to severe depression, talking alone may not suffice. You may need expert help like a psychiatrist who can help the child overcome it. And one more thing is, there is a misconception that it's all due to stress, but 50% of the cases what we find is it's not stress, but it could be just neurochemical changes in your brain, your genes, your family history, etc., which could make you more predisposed to anxiety, depression, etc. So then expert help may be needed. But talking and opening up helps 50% of children overcome their problems.
Okay, yes. If anyone has any questions, please use the chat box. Please feel free to ask questions here or on YouTube if you have any questions.
Yeah, this is just.
Okay, so
there's nothing wrong, or you can ask whatever you want. I'll try my best to answer.
Okay, I have a few more. I'll ask these.
Yeah. And if anybody wants to ask, they can unmute and ask.
Yeah, please. Okay. How can I motivate my child to be more active?
Yeah. So That's been always a concern for parents. Plus, especially in this COVID times where everybody is closeted at home, it's work from home, etc. We just don't go out, etc. It's difficult. But um, first and foremost, you need to be a role model. You need to be a little motivated. You need to be a little active. So just small things, take the child along, make them do small things so that they gain a little bit of confidence. What unfortunately happens is they move into a negative cycle. That is, they don't study, they're not active, they criticize constantly, they lose their confidence. So they have a feeling like it's called something called learn helplessness, where okay, what's the point doing it? I'm not going to get any positive comments. So a little bit of positive comments from your side, something good, and you encourage it. So that makes the child a little more confident. You help the child explore more, try something new. It may work out, may not work out, but a little bit of confidence increases. That helps the child break the chain and come out. So such things can motivate the child and help the child break out of that what do you call it, confidence issues.
Mm-hmm. You had already touched on exam anxiety,
Yeah.
but they're asking like what steps they can take to reduce their child's exam anxiety as a parent.
Yeah. So exam anxiety could be due to multiple reasons. One is basically have an anxious personality. That is, some children or some adults for no particular reason they get anxious. So such people are more predisposed. Second is children who do not study properly or try to study everything at the very last. They try to study everything, so everything gets muddled up. They get low marks. The next exam comes, they again get fearful, etc. So the easiest way out is not studying. So it becomes a vicious cycle. So the things which we can do to help the child overcome this exam anxiety is having a disciplined life, studying things on that very day. It's being taken, revise it on that week, do a re-revision before the exams so that before the exams you're pretty okay with it. Then there are children who have got this ADHD attention issues who, because of these attention issues, they have learning problems due to which um, they get lower grades, so anxiety develops. So in such children, if attention, there are medications which can improve attention, so that can help the children overcome the anxiety. But if it's a moderate to severe thing, that the child is totally blank during the exams, has multiple physical symptoms like vomiting, stomach pain, headache, etc., you may need to seek the help of a qualified mental health professional like a psychiatrist, maybe take medication, etc. Yeah.
Okay, great. So then how can I help my child deal with anger?
Yeah, okay. So anger outbursts, temper tantrums, etc. is on the rise. It's always been there, but it's on the rise due to the current situation where everybody is frustrated, closeted, etc. So that behavior management technique which I explained to you, one is to be like if the child creates a problem at home as a temper tantrum, anger outbursts, etc. You do not fight with the child, scold the child, because if you react in the same way, there's no difference between you and the child. So instead of that, what you do is you try to explain to the child why this particular behavior is wrong. Plus, you don't blame the child, but you criticize the behavior. You tell this behavior is wrong. Along with that, what you need to do is withdraw a privilege so that next time an anger outburst comes, the child at least remembers that and tries to regulate it. So the behavior management technique, which I explained before, where you withdraw privileges of the child, could help reduce anger outbursts in children. But there are some children where such behavioral techniques alone will not suffice. In such a case, we may need a little bit of expert help from a psychiatrist and maybe a little bit of medication. Because there are children who have something called impulse control disorder.
Mm-hmm.
Impulse control disorder, what happens is this frequent outbursts happen, temper tantrums happen. Along with that, what happens is they think in their mind they want it immediately. And if it doesn't happen, a huge issue could come up. Yeah.
Okay, I have just one question. We've talked about screen time. You've also mentioned screen time on the weekends, but parents are asking if it's really necessary to restrict child screen time on the weekends. Should they be able to have their free time? And
what happens is, see, from Monday to Friday, they have school, the screen time is restricted. And Saturday, Sunday, what happens is, it's 6 hours, 8 hours, 9 hours, 10 hours, 12 hours. So what happens is the body gets used to it. So even on a weekday, the child will demand for more. It's not like 0 or 100. So it's so it gets very difficult. So if you have a fixed time for weekdays and weekends, it helps. Second is the effect on sleep. If the child does not sleep, what happens if, like, say, on a weekday, the child gets up at 6 and sleeps at 10. In weekends, the child sleeps at 2 and gets up at 11. What happens is the biological clock, there's a clock in the body which gets all haywire. So the child could be drowsy in the classroom. The child could have difficulty concentrating and gets difficult. So that discipline should be incorporated during weekday and weekend. And weekend though can be a little more, but no particular timing for screen time is not the right way forward.
Okay, you'd also mentioned about addiction to apps like Swiggy and Zomato and everything.
Yeah.
So parents that are concerned that their child now are refusing to eat home food and only want to eat food that they've ordered from outside, how do they control that?
Yeah, so the first and most important thing is to have a control over this. If the parents want to order regularly, you're not a role model for your child, that the whole thing fails there. Second is, yes, we all of us can't have home food daily. We need to have food from outside, but going to a restaurant now is difficult. So the only way out is things like Swiggy and Zomato. So, but the problem is we need to keep a control over it, and because of that, obesity, etc., increases. So you have to be very particular, and you should not allow your children to order on their own. You should not give your credit card details or your Google Pay or PhonePe or other things to them so they can order. And if at all they order and you see that it's been done without your permission, you have to be very particular on the fact that that order will not be honored, or that it will not be given to the children. Because there'll be many times where they order, okay, now we can't waste it, okay, you can have it this time. So it goes on and on. So actually you're fueling the child to order, because what happens is the child realizes that once I order, my parents will not reject it, etc. But if they do so, you can withdraw their privileges so that next time they don't feel like doing so. So this is pretty important, because childhood obesity, etc., are on the rise, and even though it's not documented, you really don't know how many places these people are going to, and it is best that you restrict it. I'm not asking you to stop it, but restrict it and have a control over it.
Yeah, exactly. Okay, just a couple more minutes. If anyone has any more questions, this is your time. Otherwise, we'll slowly wrap up. I don't think we have any questions from YouTube.
Okay.
Okay, so yeah, thank you so much, Dr. Vivek. I mean, from answering all our questions, and the whole session in itself was very informative, and it was great. Thank you so much. And we'll see you again tomorrow for our session for our grade 9 through 12 student parents. And for everyone in attendance today, thank you so much for joining. And I hope you have a great evening. Okay, thank you. Good night, everybody.
Thanks. Bye.
Okay.